Hi, everyone. Truly, this is a huge honor for me. I'm Craig Goldin. You may be familiar with some of my email posts, Craig's Cosmetic Case of the Week. My wife, Dr. Marcy Goldin, and I, hi, honey, we founded the Cosmetic Dentistry Institute in Michigan. We affiliated our practice with Heartland just over a year ago. These days, I'm the old guy working with my partner, that guy there, Dr. David Whalen. Marcy teaches at the University of Michigan School of Dentistry. Passion. It's been said, if you love what you do, you'll never have to work a day in your life. That is passion. It's passion that helped us build a successful cosmetic-focused dental practice. Back in the caveman days, we had a very average, plain, not up-to-date dental practice. We also had an interest and an excitement about cosmetic dentistry. That interest grew into passion. The more cosmetic procedures we did, the more we wanted to do. Cosmetic dentistry is highly addictive. What's not to love about cosmetic dentistry? Patients want it, and they're willing to pay for it. Adding cosmetic dental procedures to our office allowed us to love doing dentistry while differentiating ourselves from other practices. Adding cosmetic dentistry to your office will ignite your passion for dentistry. I guarantee it. So how did we get to where we are today? First, we had a vision for what we wanted our practice to look like, and we wrote it down, just like many of us have done at our Thrives. That became our roadmap. Jim Collins, in his book, Good to Great, says good is the enemy of great. In our office, we decided good would never be good enough. We aspire to be great. Let's talk about building your team. It's all about culture. Just look at Heartland. What a culture we have here. Who's got it better than us? Nobody. The culture in our offices is that the doctors are the leaders. As the leaders in our office, Marcy and I knew that we needed to be upbeat and excited because our teams take their cues from us. We knew that for our team members to be comfortable speaking to our patients about dentistry and about the care they need, we needed to be comfortable also. In the book, Good to Great, Jim Collins talks about having the right people on the bus, but also in the right seats on that bus. For example, someone who's embarrassed asking for money may not be the right person dealing with finances for a $10,000 cosmetic case. Someone else may be better suited for that job. Or we need to train that shy, embarrassed team member how to ask for money. Show off your work to your team members. They will be more comfortable recommending you to the patients. Give them reasons to brag about you because that's what they want to do. Ignite the passion in your team. They will love adding cosmetic dentistry to your office. Your team members, make sure they have great smiles, whitening, Invisalign, veneers. Drag your team members into the operatory to show off how great their veneers look to your patients. This way, your patients can see your work firsthand. The patient experience. Don't be afraid to offer cosmetic dentistry to your patients for fear that you may offend them. If they don't know that you do cosmetic dentistry, they'll go to another office and have it done. I can't tell you how many times I've heard a patient tell me, I don't think my dentist does cosmetic dentistry. Really? Remember, you're not offending them. We should ask how they feel about their smiles. We should mention it. You're their dentist. They expect you to. I once heard world-renowned cosmetic dentist Larry Rosenthal speak. He said something like this: in high school, I always had a date, not because I was the best looking guy around, but because I wasn't afraid to ask girls out on a Saturday night. If someone turned me down, I went to someone else and asked them out. The lesson here is that we need to ask all of our patients about how they feel about their smiles. It will build your practice. Talk about your office. What's your office look like? What is your patient's first experience? Is your office modern and up to date? We have to have the best experience for our patients. What is your patient's first impression? It starts with the first phone call to your office. How is your telephone answered? Dental office? I sure hope not. That first experience is something that the patient will always remember. We need to make things special for them. When was the last time you looked in your office? Is your office clean? Have you been to your treatment rooms and your reception area? We need to see what our patients see by going into our treatment areas and our operatories and our reception areas and our bathrooms and checking them out. How do we educate our patients to help motivate them to have treatment? Pamphlets, educational videos, before and after photographs of your own cases. If they're interested, spend some more time with them. Offer extra amenities in your office to differentiate your practice from others, like paraffin hand waxing, warm moist towels to freshen up with after treatment, coffee, water, juice. Get them while they're hot. If a patient wants to move forward with cosmetic dentistry, schedule them as soon as possible. Do not let them wait more than a week to schedule for treatment. Don't be afraid to move things around in your schedule a bit to get a cosmetic case scheduled. So what next? Get educated. Invest in your future. Attend Heartland's Aesthetic Continuum. This is an incredible opportunity to learn how to do porcelain veneers. You should start planning for it now. Find a team member as a patient. Check out Dental XP. Attend an American Academy of Cosmetic Dentistry meeting. Read every article you can about cosmetic dentistry. Offer complimentary smile analysis to all your new and existing patients. Offer in-office teeth whitening. Offer financing options like Care Credit and Lending Club. So what now? Our story is nothing new. We followed recommendations from others who came before us. Why did we succeed where others have failed? It's because we implemented what we learned. One thing I've always done, if I wanted to make changes in my office, is to start right away, Monday morning. We ignored the naysayers, those that said, "This won't work in my office. My patients can't afford it. My patients aren't interested in cosmetic dentistry. My practice is in a blue-collar area," and on and on and on. Well, our office was in a blue-collar area for more than 20 years while we grew it into the practice that it is today. Change is hard, but it's not that hard. You are the leaders in your offices. We are supported by an incredible company that offers us continuing education like this, like the Aesthetic Continuum, and like all the other courses that are available to us. Heartland wants us to be the best that we can be. So don't let yourselves down. Go in Monday morning, change your lives and the lives of your patients and your teams. Who's got it better than us? Thank you.